thing is you have to be engaged. And so when it comes to neuro rehab, the quality metric is often assigned to how engaged you are, how intentful you are with emotions.
Hey everyone, my name is Dr. Nick Halsey with Motus Nova. I'm a licensed neurophysical therapist and neuroscientist helping brain injury survivors understand how to make functional gains after their injury. I hope this video helps you in your recovery.
I guess I just kind of want to know, like, if there's certain times of the day I should be doing therapy, if I should be doing it multiple times a day. Because I try to get at least 70 minutes a day in, but I don't know if I should be breaking that up or like what's the most effective.
Sure. Okay. Let me, it's a really good question. I don't say that often. It's a really good question. I can give you a very, very unsatisfying answer from the literature. And the unsatisfying answer is there's never been a comparison of, let's say in your case, 70 minutes, 70-minute chunk versus two 35-minute chunks. Never been done. Which means, scientifically speaking, from a pure data perspective, I can't really give you an answer. That being said, we can learn a lot from first principles, kind of biology, as well as you and how you're responding to things. So whenever we run into the limits of the scientific understanding, I like to kind of boil it back down to foundational knowledge, and then we can kind of build up from there. And one of the things that can be useful to help answer that question is how you are responding. So I want you to tell me how, like, let's say at 70 minutes, how are you feeling after that? Are you tired? Are you raring to go? Talking about kind of that process.
I'm like exhausted. I'm falling asleep at the 70-minute mark. Like that's why I have to stop, is because I start falling asleep.
Yeah, so that's a really good signal for me. Now, and I want you to be honest with me. I should also say there's zero right or wrong answers to this, right? That's not true. The only right answer, only correct answer is the one that is honest. And so when do you start to have that sensation of, I need to lay down, right? My eyes are closing, that kind of the heavy eye, the lead eyelid phenomenon. At what time point does that happen during your time?
Probably about like 45, 50 minutes in, because like it's like the last 20, 25 minutes.
Okay. Very good. And how long have you been doing the Motus hand so far?
I just made 1 month.
1 month. Okay. Gotcha. Okay. So that, hopefully you're kind of seeing where I'm driving with this. And if you don't yet, it'll be very, very apparent here in a second. So one of the most important things, you probably are very well aware of, like the amount of rehab and all that's really important, right? Dose, we hound this. Repetition is very, very important. That is the easy way of describing sort of one of those fundamental drivers of outcomes in rehab, right? Repetitions, super important, very easy, numeric. Okay. The thing is that is one side of the coin. The other side of the coin is equally as important. However, it's a bit more hard to describe. And so oftentimes they leave it to me to describe this. So fundamentally, it's quality or a quantity, which is the number of movements, and the quality is also very important. That's the kind of thing that's a bit more nuanced. And when it comes to quality in neuro rehab, it is not sufficient, or I will say it the other way, it is insufficient to just do motions. Like we could easily put the Motus hand on your left hand and move you 10,000 times in a day. That would do effectively nothing. The thing is you have to be engaged. And so when it comes to neuro rehab, the quality metric is often assigned to how engaged you are, how intentful you are with emotions. And so, and I'm going to circle back around to your question and answer that in a second.
Hey, if you're finding this video helpful, please hit like and subscribe to help other brain injury survivors learn how Motus Nova is changing neuro rehab.
If you are finding it very hard at 70 minutes to stay engaged because you're getting very tired, fatigued, whatever it is, if it's actually muscle fatigue or cognitive fatigue, inseparable in this case, doesn't really matter, and you're not able to stay engaged and get good quality rehab, we're not getting the same return on investment, right? And we want to be very efficient with your time when it comes to trying to get the most gain. And so in cases where you're finding that it is very, very difficult for you to stick out the whole time period, I want you to back away from that time frame when you are feeling that experience, that kind of sensation of tiredness. And I want to even back away a little bit more than that, because you're likely not getting as good of efficacy in those kind of minutes preceding that point when you start to actually sense that that sense of tiredness. So you're mentioning like this 45-minute framework, 50 minutes here. I don't see any reason why it would be, problematic for you to go half and half, right? Half in the morning, half in the evening. Give yourself some time to actually recuperate, put some energy back in your brain and be able to stay engaged. And I think that would also, it's another thing too, just the anticipation of, oh crap, I have to do 70 minutes of this. Like that can be kind of a big burden, instead of, oh no, I have to do 35 minutes of this, 40 minutes of this, whatever it is, I can manage that. So I think there's also some level of kind of trying to game our brains a little bit when it comes to, I don't say trick them, but when we give ourselves a task that is, we know it's a big reach for us, that can really put us off. And so we have to kind of play those factors or incorporate those factors into our decision making. So I think it'd be totally fine to have a 2 sort of chunk rehab session for you, especially because you are experiencing those fatigue symptoms and signs. So that's a long-winded way of saying, for you in particular, 2 sessions. Now, what we would want to do is we would anticipate that we would maybe build up some reserve over time and be able to go longer. But that doesn't necessarily mean that we have to do it right now.
Thanks for watching this video. If you have questions or would like to speak with me about how you can make functional gains from home, call or text me at 404-939-3476 or visit motusnova.com/contact.